Good morning, friends. Thank you for joining us for the Group Health Benefits Open Enrollment webinar. For those of you who joined us earlier for the live version of this webinar, we apologize. We were hacked. Someone came onto the webinar and it was offensive and we had to close the webinar. So we're recording this with just the presenters. We miss your faces and would rather be with you personally to share this great information and to hear how you're doing. But unfortunately, this might be the safest and best option at this point. So we hope this is informative and a good use of your time this morning. I want to introduce to you the experts who will be presenting on this call. I'm not an expert, but you know that I am the Conference Benefits Officer. I'm Carol Bruce. Your experts, your benefits team are with us. Mark Helms is our controller. There's Mark. Barbara Kilby is our benefits manager. And this is Brian Johnson with Alara Group, our awesome consultants. He has a whole team of consultants, and these folks work year-round to make sure our group health benefits are not only strong and solvent, but are excellent. And are truly helpful to all of us. So we're grateful for them. So this is sort of the way it's going to go this morning. Our agenda is this. First, Mark is going to give a really brief overview of our group health benefits. I hope it'll be particularly helpful for those of you who are new participants. And then Barbara will take over. Many of you should have received already in the mail this open enrollment packet. If you didn't, let us know and we'll make sure we'll get one to you. And as she will show you, she will be walking you through this and showing you where that information could be found on our website. So I think that'll be helpful as well. And then Brian is going to take his turn and explain to us about high deductible plan and how that works and how it might be an option for many of us. After that, on the live webinar, we were planning a question and answer session, but I'll remind you that our contact information is on the website and we would love to hear your questions after you've seen this great information today. Okay, so I'm going to share my screen right now and turn this over to Mark Helms so he can give us an overview. Okay, Mark.
All right, good morning, everyone. I'm just going to give a brief introduction to the group health plan, how it's set up, and then I'll turn it over to Barbara, who will go through the group health open enrollment process. But as many of you already know, the group health plan is a self-insured health plan. And what I mean by self-insured is that we, the conference, are responsible for paying those claims. As opposed to a fully insured plan where we pay a premium and then the insurance company pays those claims. Under a self-insured arrangement, we are in essence the insurer, okay? We have three sources of funding for our health plan. One is churches. We collect funds from churches via a monthly direct draft. We also right now, up until 2024, have apportionments that churches pay that help fund a portion of the group health plan. And then the second source is the individuals who participate in the plan. Each individual pays on a monthly basis a contribution, and that's drafted each month. And then the third source is our reserves, which are invested in the stock market, and we earn returns on the reserves, and we use those reserve balances to help pay a portion of the claims. Okay, so I just want to make it clear that we are a self-insured plan, not a fully insured plan. So keep that in mind when you think about the group health plan. We are in essence the insurer. Okay. In terms of the arrangement, we use Boone Chapman as our third-party administrator. Okay. I'm sure all of you have familiarity with Boone Chapman. That's who sends out your explanation of benefit statements when you have claims. The network is Aetna Signatures Administrators. Aetna network sets the price we pay for certain services rendered. So if you stay within the Aetna network, that is the set dollar amount that we pay as a plan for a certain service from a provider, okay? The pharmacy benefits manager, effective 1/1/21, will be RX Benefits. And you'll see in your open enrollment material that was sent out to your home, the explanation that we are changing from script care to RX Benefits effective January 1st. We also have a dental plan that is a fully insured product. You can choose the PPO or a dental HMO, and that's through the Humana network. We also have a vision plan that is also through the Humana network. And we have an employee assistance program, and the arrangement for the EAP is through the Aetna Resources for Living, okay? So it gives you a brief overview of how the plan is structured. I'm now going to turn it over to Barbara Kilby, who's going to go into the actual open enrollment process. Barbara?
Thank you, Mark, and good morning. We're so sorry about the interruption, but hopefully this will still provide the information that you need with regards to the open enrollment process and changes in benefits for 2021. So I want to take you to the conference website first and show you where all of the open enrollment information is located. So this is our conference website. If you put your cursor over Clergy on the menu bar, you get a drop-down menu. If you will go to the first column on the left and click on Benefits, that will take you to our benefits homepage. And we have all the open enrollment information started here on the benefits homepage. So again, our annual open enrollment period is November 1st through 15th. 2020, and if you want to make any plan changes for next year, you would need to submit an enrollment form to our office by November the 15th. We're going to talk about what to do in just a moment. I want to draw your attention to a couple of other items. This year it's time again for your annual flu shot. There is a quadrivalent, that's a 4-strain flu vaccine available for 2A and 2B strains. And there's also a high dose quadrivalent flu vaccine available this year for individuals who are 65 and older. The flu shot is available. It's covered at 100% under both our standard and high deductible plans, so no cost to you. And you can get that flu shot at any participating pharmacy or at your doctor's office. We also have some information about a Section 125 plan if you're interested in that on the website. And I would like to draw your attention to the contact information for our benefits team. Again, I'm the manager for the group health and pension benefits. Phone and email here. Marianela Chinea is our group health benefits specialist. She can assist you with any group health benefits concerns for active clergy and TAC lay employees. Patricia Goforth-Rakes is our pensions and retiree health benefits specialist. And for those of you who are under 65 early retirees or spouses or surviving spouses that are under 65, she would assist you with your retiree health benefits concerns or needs. And then Nancy Slade, our administrative assistant, manages our Virgin Pulse walking program. She can assist you there, and Mark Helms, our controller. So there is a contact information for our benefits team. So now I'd like you to go to what to do during 2021 open enrollment. We'd just like to review quickly the process and procedures for open enrollment. Again, hopefully you have received that open enrollment packet. This is what it looks like. Those were mailed out last Wednesday. If for some reason you did not receive yours, contact Marianela Chinea if you're an active clergy or a TAC fiscal office lay employee, or Patricia Goforth-Rakes if you're an under 65 early retiree, and they can assist you and email a packet to you. One difference in the packets this year, previously we have included a a printed page that contains your current plan enrollments, the plans that you're enrolled in this year, and also the dependents that you have enrolled. Due to COVID-19, that's a really complex process to produce as confirmation of benefits. So due to COVID-19 and our remote work situations, both for Boone Chapman and our benefits team here, we were not able to produce those printed confirmation of benefits. However, there's an easy way to get that information. And if you will go to your Boone Chapman member portal online, and here's the, and the link is on the web page. You just log into the member portal. If you have not set up your member portal account, it's easy to do. And when you go to that member portal, you can get your current benefit plans, dependent enrollments. You can get other information that's very useful, such as copies of your explanation of benefits for your claims, your out-of-pocket and deductible accumulators. You can order an ID card. So there's a lot of helpful information on your member portal. If you need any assistance with that, just contact our benefits staff or Boone Chapman, and we can help you with getting set up with your member portal. So will you have dependents enrolled in 2021? One thing all employee participants need to do, if you do have dependents enrolled, and will continue to have them enrolled in 2021, you need to complete the Boone Chapman 2021 additional insurance form, and that was actually loose on top in your packet that you received in the mail. So it's easy for you to complete that form and send it back. And this is for confirmation of benefits if you or your dependents have any other type of health insurance coverage as far as your medical plan is concerned. We don't need information if you have other dental or vision coverage, only any other type of medical coverage. So please get that form to Boone Chapman by January 1. Dependent benefit claims are limited to $1,000 every year until they get that form. So that can delay processing of claims if they haven't received that. So please go ahead and get that done right away. As in prior years, if you are not making any benefit changes for 2021, in other words, you want to keep the same plans that you're enrolled in currently, you don't want to add or term any dependents, then you do not need to send an enrollment form to our office during the open enrollment period. We will simply continue your current coverages that you are enrolled in and your current dependents for 2021. So there's no need to send an enrollment form to our office if you do not want to make any enrollment changes or dependent coverage changes for next year. However, if you do want to make any plan changes or dependent changes, you do need to complete the group health benefits enrollment form. It's on this page and also linked to on the open enrollment materials page, and I'll show you that as well. So complete this form in full. Even if you're just making, say, one single change, you still need to complete the entire form again, sign and date at the bottom, and return this form to our office by November 15th. Sorry, one thing I should have mentioned back on the Boone Chapman additional insurance form, that form needs to be sent directly to Boone Chapman. At the top of the form is their email. There's a dedicated email for our group and a dedicated fax number and also the mailing address. So the Boone Chapman additional insurance form needs to be sent directly to Boone Chapman. We do not need a copy of that in our office. But the group health enrollment form, if you are making changes for next year, at the bottom of the form, here is the contact information to send that to Marianella's attention, either by email, fax, or by snail mail. So if at all possible, we need those as quickly as you can, but by the deadline of November 15th. If you are an under 65 early retiree or under 65 surviving spouse or spouse of a Medicare primary retiree, you have a different enrollment form. It's the green and white 2-page form. Again, you need to complete this in full only if you want to make benefit changes for next year. And you would send that to Patricia Goforth-Rake's attention. Here's her email, the fax, or again, you can mail that to our office by November 15th. And just a reminder, early retirees or under 65 spouses, surviving spouses, are not eligible to add any new dependents once you are in retirement status. You could term a dependent, but you cannot add new dependents if you are an under 65 early retiree or spouse or surviving spouse. If you are interested in enrolling in new dental coverage, again, as Mark indicated, we have two dental plans. We have a dental PPO and a dental HMO. This is a summary of the two plans. I'm not going to go into detail on this. There are no benefit changes to our Humana dental HMO or dental PPO plans for next year. And also, thankfully, no rate changes. So these rates are the same as they have been now for a couple of years. So there's your dental HMO, your dental PPO, and then we also have a vision plan. So information about these plans is included in this summary and a kind of a comparison between the two dental plans. If you are enrolling in the dental HMO plan, you must pre-select a participating dental HMO dentist and indicate the dentist's name, ID number, and address on the group health enrollment form. And here are some directions. You go to the Humana website, humana.com. We've given you some pretty detailed directions. Unfortunately, Humana tends to change their website up fairly frequently, and I can't guarantee that this will be accurate when you go there. I hope and pray it will be, but it'll get you started. One of the important things to know is that you do have to indicate which plan you're searching for a provider in. So here's the name, that it's the HD DHMO prepaid C250 plan for the dental HMO, or the PPO traditional preferred for the dental PPO. So this will give you specific directions on how to locate a dentist under either plan. However, you only have to pre-select a primary care dentist if you're enrolling in the dental HMO plan, and that information does have to be on your enrollment form. And then there's some additional information about the vision plan. After annual open enrollment ends, you will not be able to make any plan changes or changes to your dependent coverage unless you have a qualifying event such as the birth of a child for a special enrollment period. So this page kind of gives you the overall process of what to do during our 2021 open enrollment period. Again, if you want to make plan changes, please submit your enrollment form to the benefits office by November 15th. If you do not want to make plan changes for next year, you do not need to submit an open enrollment form to our office. However, if you do have dependents enrolled, you do need to complete that 2021 Boone-Chapman annual additional insurance form and get that sent up to Boone-Chapman by January 1. All right, that's a summary of the process. Now I'm going to take you to the 2021 open enrollment documents. So this is the list of all the documents that were included in your packet, and there's some additional documents as well. So we're going to go through some of these in depth, and others I'm just going to let you review if you are interested. I want to point out that there's two sections to this page. The first section is the active clergy, active TAC fiscal office lay employee section. So these documents pertain to active clergy or active lay employees. So document number 1 is just the cover letter that was in the packet. Again, a summary of the instructions that we just went over. Overview of changes, we're going to look at that in depth. And here is another link to the group health enrollment form for active clergy. So you can get it on this page as well. Here's a link again to the Boone-Chapman additional insurance form. So it's also available on this page as well as on the previous page. Now, if you are an under 65 early retiree or an under 65 spouse of a Medicare primary retiree or an under 65 surviving spouse, these are the 4 documents that pertain to you: your letter, your instructions, your overview of changes. Then again, here is the U65 open enrollment form posted there. and also the Boone-Chapman additional insurance form. Primarily, the packets are the same. There are some differences in the rates. So if you're an under 65 early retiree, you will get your benefit rates right here in this overview of changes. But all other benefits pertain to both active and early retired retiree participants. All right, so let's look at the 2021 overview of changes. So these are the benefit changes for next year. I want to draw your attention to the fact that there is no change to the deductibles for 2021. The individual deductible under the standard PPO plan remains at $1,000, the family deductible at $3,000. However, we have had for a number of years a wellness deductible credit. It's a $200 wellness deductible credit. If the employee has attended the day of wellness, they receive that credit for the employee and any enrolled dependents. And if the spouse has attended the day of wellness, they have received this $200 wellness deductible credit. This deductible credit is being eliminated for all plan participants, both the standard and high deductible plan participants for next year. So you will no longer receive the deductible credit. So even though the deductible amount is actually staying the same, if you have received that credit, you will no longer get that $200 reduction in your deductible for 2021. No change in the office visit copays under the standard PPO remains at $30 primary care and $40 specialist. We also have a separate prescription drug deductible under the standard PPO plan, $50 for the individual, the family deductible at $100. When you are in network, you have an out-of-pocket maximum that would be the maximum that you would spend out of pocket in a calendar year. That remains at $4,500 per individual with a separate $2,000 out-of-pocket prescription drug maximum limit. The family out-of-pocket maximum is increasing from $9,600 to $10,000 next year. That's a small increase. And there is a separate prescription drug for $1,000 out-of-pocket maximum limit under the standard PPO plan. The out-of-network, out-of-pocket maximum is actually decreasing next year from $68,000 to $50,000, and that's under both plans. The high deductible plan, again, no change in the deductibles. The individual deductible remains at $1,850, the family at $3,700. However, again, you will not receive that wellness deductible credit if you have been receiving that previously. And another important detail to note, the high deductible plan is a combined medical and prescription drug plan, and that means your deductible applies to both medical and prescription drug benefits. So there's no separate prescription drug deductible as there is under the standard PPO. So you have to meet the full deductible, whether it's the individual or the family deductible that applies before you will receive either medical or prescription drug benefits under the high deductible plan. We have actually decreased the in-network out-of-pocket maximums under the high deductible plan. The individual medical prescription drug out-of-pocket limit has decreased from $6,650 to $4,500. And the family out-of-pocket limit has decreased from $13,300 to $10,000. So those actually now are the same as the standard PPO. And then the out-of-network, out-of-pocket maximum, again, is decreasing from $68,000 to $50,000. This is a side-by-side comparison of the two plans. Ryan is going to be giving you some information later on about the high deductible health plan and how that works. And one of the benefits to a high deductible health plan is setting up a health savings account. So he's going to be giving you more detailed information on that. But this little side-by-side comparison, I think, can be helpful if you're considering one or other of these two plans. Again, we've already talked about the deductibles, and again, under the high deductible plan, it is a combined medical and prescription drug deductible. under the standard PPO, you have that separate prescription drug deductible. So if you have met the prescription drug deductible under the standard PPO plan, even though you haven't yet met the medical deductible, you can go ahead and get prescription drug benefits under the standard PPO plan. But with a high deductible, you've got to satisfy that full deductible before getting any benefits. There are the out-of-pocket maximums again, and also for the prescription drug out-of-pocket max. One difference too between the standard PPO and the high deductible plan, as you know, we have a phenomenal benefit that Houston Methodist Hospital offers us, where participants in our standard PPO plan, if they have any type of either inpatient or outpatient services at any Houston Methodist Hospital location, the hospital writes off any deductible or coinsurance amounts the participant would have to pay to the hospital, or nearly that. The write-off does not cover doctor charges, so you still would have to pay any applicable doctor deductibles or coinsurance, but that Houston Methodist Hospital write-off is not available under the high deductible plan. And that's because under the high deductible plan, you actually have to pay that full deductible amount before you get any benefits under the plan in order to qualify to have a health savings account. So that's an IRS regulation. So the write-off is not, of Houston Methodist Hospital write-off is not available under the high deductible plan. However, under a high deductible plan, you are eligible to open a health savings account. In addition, the high deductible contribution amounts are lower than for the standard PPO plan. So when you open up that health savings account, that's a tax advantage plan, you can pay for your deductible expenses out of that health savings account. And Ryan will talk further about that. Again, under the standard PPO plan, you have an office visit copay. So if you're just going to the doctor, you would pay that $30 primary care or $40 specialist copay, and that would cover the cost of the office visit. Under a high deductible plan, there is no office visit copay. So again, you have to meet your full deductible, and then the plan would pay the applicable either 80% in network or 60% of maximum eligible charge out of network. So no office visit copays under the high deductible plan. We have a teledoc visit benefit that's a great benefit for certain situations. Say you have the flu, say you have an upper respiratory or a skin infection or urinary tract infection. Those are the types of things that you can use the teledoc benefit for. Those are board certified pediatricians, primary care doctors, and internal medicine doctors. You have a zero copay for that under the teledoc, under the standard PPO plan. Under the high deductible, you do have to pay the $49 office visit fee until you meet your deductible, and then you would have your 20% coinsurance. There's a special prescription drug benefit that we have, but I am going to talk about that now as we go into our change of our pharmacy benefit manager for 2021. I'm going to take a drink of water here, sorry. All right. I think most of you are aware, we have been under a search process for a new pharmacy benefit manager over the past several months. Script Care has served us very well, but we have found over the years that a significant part of our total claims cost each year are related to our prescription drug benefits. And the way these situations work with a pharmacy benefit manager, the larger the pharmacy benefit manager is, the greater clout they have to negotiate deeper discounts and rebates with pharmaceutical companies. And so engaging in this search, we have retained the services of RX Benefits as our pharmacy benefits optimizer, and Express Scripts as our pharmacy benefits manager effective January 1, 2021. And Script Care has done a great job for us. However, they're a kind of a mid-sized player, and they simply cannot offer us the same level of discounts and rebates that can dramatically impact the cost of our prescription medications. And we are actually looking to recoup on our rebates and discounts over $900,000, which is almost double what we are currently receiving from Script Care. And so that has a huge financial impact to our plan. So effective January 1, 2021, RX Benefits and Express Scripts will be providing prescription drug benefits to our members. You will receive a welcome packet from RX Benefits about the first week in December with information about the plan. We will also be mailing out new ID cards. Ben Chapman will be doing that for you probably about the 3rd or hopefully about December 15th. As you know, our prescription drug card, or I'm sorry, our ID card is a combined medical and prescription drug ID card. So it will have the new RX Benefits and Express Scripts information on your new ID card. Those get mailed out in kind of plain white envelopes. Nothing indicates that it's a new ID card, to avoid hopefully someone trying to steal that card from you. So please be on the lookout for those new ID cards. They will kind of come in a plain white envelope that might be mistaken for junk mail. But you will be getting that new ID card, and you will need to use that new ID card starting January 1 to get your prescription drug benefits and your medical benefits. We did go through a really significant search process in evaluating pharmacy benefit managers. RX Benefits offers us some additional services that we have not had available to us under Script Care. And one of the programs that they offer to us is it's called low clinical value. And this is really a slide that gives you some information about what this program will do for our group health plan. There are, as you know, pharmaceutical companies are always coming up with new medications. And what RX Benefits will do is evaluate these new medications. And if a new medication is especially if it's an expensive medication, they're going to look at it to see what the true clinical value is for this prescription drug. And shockingly, or maybe not so much, sometimes pharmaceutical companies will come out with a new medication that really doesn't offer much in the way of therapeutic value. It may be something very similar to a previous medication or even a generic medication that's been on the market for a while. But this is an example of what the RX Benefits low clinical value program will do. There is a new prescription medicine called Deductibles. This medication costs $2,700 for a 30-day supply. So it's a very expensive medication. However, all this medication is a combination of 2 over-the-counter medications, Advil, which you know is ibuprofen, that's an anti-inflammatory over-the-counter medication, and Pepcid, which is an antacid. It's used for heartburn or acid indigestion. If you were to buy the equivalent medication that Deductibles provides over the counter with a combination of Advil and Pepcid, the cost would only be $42.86 for a 30-day supply versus $2,700 for the prescription medication of Deductibles. That is 63 times the cost. And I don't know if you are as outraged about that as I am. I think we all are, that the pharmaceutical companies play these games sometimes. They come up with a new medication that really offers, in this case, no additional therapeutic value than what you can get by taking 2 separate medications. They've just combined it into one. So RX Benefits will evaluate these, and it was interesting, the pharmacy manager pharmacist that RX Benefits, their clinical pharmacist, indicated that often doctors are not aware of these types of medications. In fact, her mother is a primary care doctor, and when she explained to her mother about this medication, even though her mother is a medical doctor, she was not aware that that's what this medication really is. It's a combination simply of 2 over-the-counter meds at a much higher cost. So the pharmaceutical reps go, they provide coupons and samples to doctors, and doctors are not often aware of what the true clinical value is. So this is going to assist us in also reducing our prescription drug costs. We're anticipating another $200,000 potential savings through these types of programs that RX Benefits can provide to us. In addition, RX Benefits has outstanding customer service. I actually did phone calls with 5 different references that they provided to us. I want you to know that each one of those references that I spoke with absolutely gave extraordinarily high marks to RX Benefits for the level of customer service that they provide, the ease of the transition from their prior prescription drug plan to RX Benefits and Express Scripts, and the feedback was just excellent across the board. So we feel like that RX Benefits and Express Scripts will provide you with outstanding customer service, and we're very hopeful that you will find that to be the case. As with any pharmacy benefit manager, they do have a prescribed formulary of what medications, brands, and name medications will be included on the formulary. So there will be some differences with the current formulary that ScriptCare has. If you are taking a prescription med that's not going to be on the Express Scripts formulary, you will receive a letter about the second week in December with other alternatives. So take that letter, discuss that with your medical doctor, and hopefully one of those alternatives will work successfully for you. If you have tried the alternatives and those have been unsuccessful, there is a process for your doctor to provide letters or medical records for a medical necessity provision for one of those excluded medications. But we ask you to work through that process with RX Benefits. Another thing I need to mention to you, currently we have a special, what we call chronic illness medication benefit, where generic medications for certain chronic illnesses. So this is asthma, high blood pressure, high cholesterol, diabetes, and proton pump inhibitors are available at no charge. We will continue to provide that same benefit under RX Benefits. However, due to the change in the formulary, there could be some differences there that you will still, we will still offer that benefit, where certain generic prescriptions for those 5 conditions will be available under the standard PPO at no charge. Due to the IRS regulations with regards to high deductible health plans, only preventive care can be provided under a high deductible health plan at no charge prior to a participant meeting the deductible. So this benefit under the high deductible health plan will be only for generic preventive prescriptions for the treatment of asthma, high blood pressure, high cholesterol, and diabetes. So I want you to be aware of that difference. Another piece of good news, we currently have a $10 additional per prescription copay at Walgreens pharmacies under our ScriptCare plan. That will be eliminated effective January 1, 2021. So there are some documents on the website with further information about RX Benefits, and I'll point those out to you before I pass the baton to Ryan in a minute. I need to also review with you a change in one of our mental health benefits for next year. just briefly, as you know, being a clergy or a clergy family member is a tremendous blessing, but it can also be stressful, especially in the current situation we find ourselves with COVID. And equally as important as maintaining good physical health is maintaining good mental and emotional health. And we do provide a really strong mental health benefits under both our standard PPO and our high deductible health plans. Just to briefly review, we offer an employee assistance program that's available actually to all active clergy and dependents. Even if you're not enrolled in our group health plan, you can avail yourself of services under the employee assistance program, and that provides 6 sessions per issue per calendar year at no cost. There is an 800 number. It's on the website under our mental health benefits. You just call that number. They will give you a referral to a provider in your area. And again, that's at no cost to you or your dependents. And it's up to 6 sessions per issue per calendar year. So if you have multiple issues, you could get multiple 6-session components under the employee assistance program. We also have unlimited mental health counseling benefits under both medical plans. So under the standard PPO plan, if you're in network, you would pay your $40 specialist copay. Under the high deductible health plan, you would meet your deductible and then you would pay the applicable co-insurance in or out of network. So those under both medical plans, you are able to receive unlimited mental health counseling benefits with the payment of either the applicable copay or co-insurance. But we've also had a third mental health benefit that is currently called the Exclusive Provider Organization, or EPO for short. This counseling benefit provides up to 50 counseling visits in a calendar year with a $25 copay. But it's limited to using 8 contracted EPO providers. It started with Chris Samaritan Center here in the Houston area. We've gradually added a few other providers over the years, but all but one of those providers currently are in the Houston area. So the desire was to expand this benefit throughout the conference. So next year, starting 1/1/2021, we are changing the name of the Exclusive Provider Organization Mental Health Counseling Benefit to a Supplemental Counseling Benefit. We had originally called that an out-of-network counseling benefit. That was in the group health report. You get out-of-network counseling benefits under both medical plans, so to avoid confusion, we've renamed that Supplemental Counseling Benefit. It is in addition to mental health benefits under both the Employee Assistance Program and under both the standard and the high deductible medical plans. So it's an additional and separate supplemental counseling benefit. So in 2021, if you're in the standard PPO plan, any licensed mental health provider can utilize this benefit to provide up to the maximum 50 counseling sessions in a calendar year at that $25 copay. If the provider is willing to bill Boone-Chapman for that service, they can do that. You would only pay the $25 copay. If not, you would need to pay the full fee out of pocket. The plan reimburses the provider $95, so the total fee with your copay is $120 per office visit. If the provider is not willing to bill Boone-Chapman, then you would need to pay the full amount out of pocket and then submit the receipt and a claim form for reimbursement to Boone-Chapman. So it can work either way depending on what the provider is willing to do. Now, you can receive marriage and family counseling benefits under both the Employee Assistance Program and also under the EPO benefit, now to be called the Supplemental Counseling Benefit. Marriage and family counseling are not available under either the standard PPO or the high deductible health plans. That's because you have to have a diagnosis for a mental health condition such as anxiety, depression, or so forth. So unfortunately, marriage and family counseling is not provided under either medical plan, that you can get marriage and family counseling under both the Employee Assistance Program and the Supplemental Counseling Benefit. As we were reviewing all of our open enrollment materials, we were made aware of some recent regulations that the IRS has with regards to high deductible health plans. Again, under a high deductible health plan, you can only receive your annual wellness benefits. So that's your annual physical checkup, your mammogram or pap smear, your blood work, at 100% prior to meeting your deductible. That's an IRS regulation in order for you to have a qualified health savings account and get those tax benefits under the high deductible plan. So there are certain other types of permitted insurance that you can have with a high deductible health plan and still qualify for a health savings account. So a dental or vision plan, the employee assistance program is another type of permitted insurance, but unfortunately this supplemental counseling benefit does not qualify as one of those other types of permitted insurance that you can have under a high deductible health plan. So we were not able to provide this supplemental counseling benefit to our high deductible health plan participants as originally intended. So the supplemental counseling benefit will only be available to standard PPO plan participants effective January 1, 2021. All right, there's some different additional information here, and there's that note about that exclusion for high deductible health plan participants. A couple other benefits real quickly before we move on. We currently have in place an additional copay. If you were to have a non-emergency inpatient admission to a hospital and you live in certain applicable zip codes surrounding a Houston Methodist Hospital facility, you would have additional $2,000 copay if you were to go to another hospital other than a Houston Methodist Hospital, if it were an elective procedure like a knee or a hip replacement, a non-emergency inpatient hospital admission. That copay is being eliminated effective January 1, 2021. In addition, as I said earlier, we are decreasing the out-of-network, out-of-pocket maximum expense limit from $68,000 to $50,000 effective January 1. Another benefit change currently, your wellness medical benefits are covered at 100%, whether you go in network or out of network. So again, that's your annual wellness exam, your annual physical, your associated screenings like a mammogram, a pap smear, your blood work, or so forth. It's effective January 1, you will only get your annual wellness medical screenings covered at 100% if you go to an in-network provider. And that would include not only the doctor, but labs, or someplace where you went to get your mammogram or so forth. So make sure that you go to an in-network provider for your annual screenings in order to have that covered at 100%. If you go out of network, you would have to meet your deductible and pay the applicable coinsurance. There are a few wellness program changes for next year. We have made some changes to some of our wellness program incentives. Those that will not have any changes, that will remain the same in 2021, our annual maintenance incentive under our wellness program, where if you have reached a BMI of 25 or less and maintain that BMI, you can earn $1,000 if you've are a participant in our wellness program, $1,000 annual maintenance incentive, and that is not changing for 2021. In addition, if you lose 5% of your starting weight at the day of wellness, you can earn a $200 weight loss incentive, or if you also, in addition to that, when you lose 10% of your starting weight from the day of wellness, you can earn another $200 weight loss incentive. Those are not changing for 2021. And the total amount of weight loss and annual maintenance incentives that you can earn in a calendar year is limited to $2,000. So that these are not changing next year. However, we are making some changes in the following wellness program incentives. As I mentioned earlier, the $200 wellness deductible credit has been eliminated for all standard PPO and high deductible plan participants effective January 1. There will no longer be a wellness deductible credit. We currently have a 50% weight loss incentive, losing half the weight to reach a BMI or 25 or less. That is being eliminated next year. The 100% weight loss, losing all the weight to reach a BMI of 25 or less, is being reduced from $1,000 to $600. The pregnancy weight loss incentive, currently, if you lose all the weight that you gained during pregnancy, get back to your first trimester weight within a year following delivery, you earn a $2,000 pregnancy weight loss incentive. That is being reduced to $1,000. So that will change next year as well. And then we currently have an incentive for weight loss before attending the date of wellness, and that is being eliminated. So the total amount of weight loss incentives that you will earn, or you could potentially earn, would be $1,000. Then you have the additional pregnancy weight loss incentive of $1,000 and your annual maintenance incentive of $1,000. Even with these reductions, our weight loss incentives are extraordinarily generous. Most wellness programs, you might earn a $25 gift card by achieving some type of weight loss or other wellness incentives. So even with these reductions, these are still amazingly generous for our members. In addition, we have our walking program that's separate from our wellness program. Currently, you can earn $150 a quarter by reaching certain point targets. Those incentives are also being reduced by 50%. So the total walking program incentives you'll be able to earn in 2021 is $75 a quarter, but that's still $300 per year if you meet the maximum incentive target per quarter. So again, very generous incentives even with these reductions. All right. I want to point out to you some changes in the group health contribution rates for next year. The church group health contribution rate is increasing from 7.8 to 9.8%. That's 9.8% of the clergy's total health benefits compensation as specified on the clergy salary sheet for 2021 and 2022. But a reminder, this is not a true rate increase. As Mark mentioned earlier, we are in the process of eliminating the current $2 million group health apportionment over the next 4 years. We're reducing that annually by $500,000 so that by 2024, there will no longer be any group health benefits apportionments that the churches will pay. And we will collect the total amount of contributions for our group health benefits from those church contributions and the clergy contributions in our monthly benefit drafts. So this is really to offset the loss of the apportionment dollars for 2021 and 2022, which is going to be a total of $1 million reduction in the next 2 years. Clergy contribution rates are going up for the standard PPO plan, but they're actually going down under the high deductible health plan. So again, this percentage, you would multiply it times your total annual health benefits compensation on your salary sheet. So multiply it by 0.0925 if in the standard PPO family plan. That would be your annual contribution amount as a clergy, and divide it by 12, and that would be the monthly amount that you would pay. And then here are the similar rates under the high deductible plan. Clergy on medical leave pay a fixed dollar amount as part of our direct billing rate. Here are those rates, and also our fiscal office lay employees also have a direct billing rate that they would pay. So those are your rates. And if you're an early U65 early retiree, if you'll go to that overview, and I will show that to you. I want to get rid of that. Let's X out of that. X out of that. Sorry. Okay, I guess I lost my, let me get back to the website here for us. Okay. I do want to just point out quickly a couple of other documents for you to look at. I showed you earlier the Humanital Vision Plan Summary if you're interested in enrolling there. We have individual brochures for the dental HMO, the dental PPO, and the vision plan. They're located right here. In addition, there's a welcome brochure on RX benefits, some information about the pharmacy program. Also just want to quickly draw your attention. We have this included in your open enrollment packet. We want to continue to provide some education to our members on how to best utilize benefits. We want you to get the appropriate level of care for your particular need. And there are certain times that it's absolutely essential to go to an emergency room. There are other times that perhaps an urgent care center or even our teledoc benefit might provide the care equally effectively at a more affordable cost. So just something for you to review there. And then I will also want to point out to you, here's the flyer that was included in our open enrollment packets on the high deductible plan and health savings account that Ryan will review. But I've also included here an HSA guide. This was not in your packet, but it has more detailed information about health savings accounts, and Ryan may want to review that in greater detail with you, but it is located on our website. And then a teledoc benefit there that gives you a brochure. And then these remaining documents, 15 to 22, these are required government notices that we send out in the open enrollment packets. This is your summary of benefits and coverage in the prescribed Affordable Care Act required format. So I'm sorry, I lost my little, let me X out of that. I'm sorry, and I lost the website again, I apologize. Let me get back there. So that gives you your summary of benefits and coverage. Also the high deductible health plan, we have the same, and some additional required government notices. So you can look at those if you're interested. All right, that takes care of the overview of benefit changes for next year. I am going to stop my screen share and let Ryan take the baton from here on out. Thank you for your time and attention. We appreciate you.
Thank you, Barbara. As Carol and Barbara mentioned, my name is Ryan Johnson. I actually work with a company called the Lara Group, and we are a benefits consulting firm, and I've helped your team at the conference to put together this benefit program. We look at a lot of different clients' programs, and you guys definitely do have a very generous and great benefit program, I must say. Some of the information we're going to go through here is really just to help make sure you guys understand how the high deductible health plan and health savings account work. So you have two great programs that both use the same Aetna signature network, and they have the same pharmacies in network. The big difference on these two plans is your cost share. So I want to just help make sure you guys understand how to interpret some of the information, and then you can do some math on your own and figure out what program might be better suited for yourself and your family. So there's a couple key components to be aware of, and you heard Barbara mention it a couple of times. We have the high deductible health plan, and when you enroll in what's called a qualified high deductible health plan, the IRS says that you could open a health savings account. Okay, so you have the health plan that is administered through Boone Chapman using the Aetna network, and then you have the ability to open a savings account separately. Okay, there's a bit of an overview on this page from that you can see from your open enrollment documents. And as Barbara mentioned down here, item number 13, we have some additional information on health savings accounts that I wanted just to kind of walk you guys through. So the first 2 pages was in the packet that was mailed to you. This document here has about 18 or so pages, I think, in here. So I'm not going to go through all of these, but I do want to make sure you are just aware of where this information is and how to interpret some of this stuff. So as I mentioned a moment ago, a qualified high deductible plan is what we're talking about here. It has the same network, just a different cost share. So you have lower premiums on the front end that you as a member would pay when you participate, and you do not have co-pays when you go to the doctor or your pharmacy. So you actually pay the contracted rate that Aetna or your pharmacy benefit manager has with that provider when you go get those services. One of the trade-offs when you do that is you can open this tax-favored health savings account. And these are governed by IRS rules. And so I want to make sure you guys understand how these things work. So an HSA, you can think of it like a retirement program or savings account really attached to your health and welfare costs that you would have next year and the following years all the way through. One of the great things about this is when you put money into a health savings account, you are not subject to federal income taxes or state income taxes. So one of a really big advantage is you save on your tax bracket, which might be 20, 30% of whatever your earnings are. So if you put $3,000 into an HSA and you're at 30% tax bracket, you'd save about $1,000 in taxes. So again, something to be mindful of when you're doing the math. So if you look at your contributions, you look at the difference in out-of-pockets, and then also look at your potential tax savings. So how an HSA works, it's just like any other bank account. It would be in your name or your spouse's name. And that money is deposited by you, and it will always be your money, okay? So you can choose to make payments or deposits in that account throughout the year, or you could choose to do a lump sum deposit at the beginning of the year. You can only open a health savings account after you're enrolled in a qualified high deductible plan, and you can only use HSA monies for items that are incurred after that account is open. A couple of things really important to keep in mind. Okay, so if you have a bill from 2000 while you're in a copay plan, you cannot pay that bill in 2021 with your HSA because you incurred those costs before the HSA account was open. Another very, very important distinction is if you do not open your account in January and you wait until March to open that HSA account and you incur something in January or February, those items would also not be eligible for an HSA reimbursement because, again, your account was not open when you incurred those expenses. So just be very mindful of the timing. Once you're enrolled in the qualified plan, you can then open a health savings account. And then you can use those HSA dollars and funds to pay for any qualified expenses. So they can apply to your medical, dental, and also vision expenses. So there's a lot of items that you can pay with those. And I'll show you in a moment in this document a list of some of those. As I mentioned before, it is a bank account in your name, so it's yours to keep. You own it. So if you were to move on from TAC, you go anywhere, this is always your money, even if you retire. Okay, so just something to keep in mind. This is always your money. You can build up a cash value. You can actually use it for investments and have that money grow tax-free as well, just like you would a 401k or some other retirement program or an IRA. So the IRS does set limits on how much money you can contribute into a health savings account. So for 2020, the limit for individuals is $3,500, and for 2021 is increasing at $3,600. If you're enrolling yourself plus dependents, you'd be under the family tiers. You have a limit of $7,100 for 2020, and for 2021, you have a $7,200 maximum limit. If you're over the age of 55, you can contribute an additional $1,000 on top of the numbers that you can see here in this bar chart. Okay. Some really important regulations to be aware of. As I mentioned before, in order to be eligible, you have to be covered under one of these qualified high deductible health plans, okay? Which means you cannot have co-pays. You have to meet your minimum deductible before the plan pays for anything. If you're enrolling in a high deductible plan, you cannot also be enrolled in a co-pay plan elsewhere, like a spouse's co-pay plan, because that would then disqualify you from having a health savings account. Also really important, you cannot be enrolled in Medicare, okay? So for those of you that may be Medicare eligible, meaning you're receiving benefits from Medicare, you can just be enrolled by turning 65 and getting Part A. It doesn't mean you're necessarily using Medicare. You could still be using the TAC group health plan, but you're actually enrolled in Medicare. So if that it falls into your consideration, you might need to do a little bit of extra research, and we can help provide some information for you on that. There's also some considerations of if you are in Medicare, you could disenroll from Medicare, but there are some things that you have to look at with regards to your Social Security benefits if you've started to collect those as well. Also, in order to be eligible for an HSA, you can't be claimed as a dependent on someone else's tax returns, and you also are not receiving benefits from the VA in recent months. So really important for you just to kind of understand, there's a lot of information in here. I just want to point out to you just kind of how to read and interpret it. There's more information that you can do research online. You can always Google HSA rules. You can go to the IRS's website. We've also put in here a helpful link. So it will be your responsibility if you want to open a health savings account, provided you're eligible. It will be your responsibility to open your HSA. And we have provided a link for one bank that you could choose to use. You could also choose to open it at your current bank relationship of Bank of America, Chase, Fidelity, whatever that might be. But one option that you might want to look into is HSA Bank. It's a very simple, very easy process for you to open it, but it is something that you have to do on your own because it is an individual savings account. As mentioned before, we do have some changes to the contributions to where the high deductible plan is a bit more attractive. The deductible is a little bit higher. You can see in this bar chart. Our out-of-pocket max, this is not including the standard PPO's pharmacy, which is another $2,000. So you actually do have a net, a little bit better out-of-pocket max on the high deductible plan. So again, when you're considering what plan makes the most sense for you, do a little bit of math of your expected out-of-pocket costs and what you've maybe utilized in the past. To give you a couple of tidbits of information, all preventive on a high deductible health plan is still covered at no cost. So your annual physical, your well woman, well man checkup is still covered at no cost. But if you're going in for a regular office visit, you might pay 60 or 100 bucks for that visit. If you're going in to see a specialist, it might be double or triple that. You'll pay, again, that contracted rate that Aetna has with that particular provider. And these plans have been around for more than a decade, and they've been really increasing in popularity over the last handful of months because it gives you as a consumer more control to go where you want to go. You save some money on the front end, and then you pay as you go, as opposed to more prepaying for services. And the additional pages in this document goes through some additional some HSA benefits, talks about some of the portability, how they work, some of the IRS rules that we talked about a moment ago, and then talks about some of the advantages of if you're saving money, how you can build a cash value in your health savings account over time, because you're investing your money on a tax-free basis and it grows tax-free. And it always stays tax-free as long as you are using it for qualified expenses. If you use it for non-qualified expenses, you will pay a 20% penalty. So just something to be aware of. And you also may be subject to income taxes on that. There's a few case studies in here to kind of walk you through kind of how you could consider doing the math on your own based off of your historical benefits. and procedures, and then a record keeping guide. And then in the back here, we actually have a list of some qualified medical expenses that your health savings account could be used for if you do choose to enroll in the qualified high deductible plan and then open the HSA. So with that, I hope you guys spend a bit of time in going through this. And again, this is number 13 on your website. And just do a side-by-side comparison from a financial analysis and figure out which program is a better fit for you and your family. With that, I'll turn it back over to Carol.
Awesome. Thank you so much, Ryan. And thanks to all of you who took the time to watch us today. We're thrilled to be with you. So grateful for Mark and Barbara and Ryan and the expertise they shared. And we're grateful for you as participants. This is the point in a live webinar where we were hoping to answer your questions, and that's not possible. However, we are still here to answer your questions. So please go to the website, contact us. We look forward to hearing from you. In the meantime, stay well. Go in peace, friends. We'll see you next time. Bye-bye.